And this is about to be really personal, so if you get grossed out, scroll. First, your coochie will stink. It will. Your coochie, your underarms, your boobs, it all sweats and it all stinks. Like you could wash and scrub daily. By the end of the day, you are sweaty and you stink. Like, you're musty, you're sweaty.
Welcome to my pregnancy diary, where the ultimate adventure begins. Because pregnancy is the labor of love. Tiny feet, big impact. Burn in the oven, love in the heart. What's your story? Today, we will be focusing on the not so glamorous aspects of pregnancy. First on the list, we've got morning sicknesses. For some, it's an all-day museum. While morning sickness is often thought to be confined to the morning, it can last all day, especially in the first trimester. It is caused by fluctuating hormone levels, and for some women, it can be severe enough to cause weight loss and dehydration. Hyperemesis gravidarum is a severe form of morning sickness, and it might require hospitalization for IV fluids and medication to help manage the symptoms. You may ask, what can help? Well, here are a few solutions for you. Eating small frequent meals, inputting ginger either in ginger tea, candies, or capsule, staying hydrated with electrolyte drinks, and taking prescription medication like Zofran. Secondly, when you are pregnant, you are more likely to experience swelling or what is called edema. Swelling, particularly in the feet, the ankles, and the legs, is common during pregnancy, especially in the third trimester. The body's increased blood volume and the pressure in the growing uterus can make it difficult for blood to flow back from the lower extremities, resulting in swelling. What may help in this case? Elevating your feet when sitting, wearing compression socks, and drinking plenty of water. On number 3, we have breast changes and leaking. From early pregnancy, breasts undergo significant changes in preparation for breastfeeding. They become sore, tender, and may grow in size. You may also start leaking colostrum, the first milk your body produces, as early as the second trimester. For some women, leaking can be embarrassing. So, you may ask, what helps then? Wearing nursing pads to absorb leaks, especially the disposable or washable ones, right? And choosing comfortable, well-fitting bras can help you. On number 4, we have a lot of women, a lot of females who experience stretch marks during pregnancy. So what you need to know is that stretch marks are caused by the rapid expansion of the skin, and they are more common as the baby grows in size. Now, genetics plays a huge role. If your mom had them, you might too. They can show up in the stomach, in the thighs, in the breast, or in the buttocks. While they fade over time, they never fully go away. So what can help in this case? If you use a thick moisturizer or oil to help your skin stay elastic, although it doesn't always prevent them, it can help you. And if you stay hydrated and maintain a healthy way to avoid repeat stretching, then you can avoid having stretch marks. Okay, let me rather use the word minimize having stretch marks. So on number 5, we have gas and bloating. Gas and bloating is normally caused by hormonal changes during pregnancy. How does this happen? So hormonal changes during pregnancy can affect your digestive system, and that could lead to a slower digestion and an increased gas production. Now this, coupled with your growing uterus, can lead to bloating and discomfort. When the gas is too pungent, it can lead to you feeling more awkward. So you may ask, in this case, what is the best solution? Well, eating slowly and avoiding gas-inducing foods like beans, broccoli, and carbonated drinks can help you. Also, gentle exercises like walking can help your digestive system move more efficiently. Now, let us talk about constipation. The hormonal changes that slow down digestion can lead to constipation. When the uterus grows, it puts pressure on the intestines, and that further contributes to this issue of constipation. This can be uncomfortable and lead to straining, which may cause hemorrhoids. Alright? What could be the solution to this constipation issue? You can stay dehydrated. You can start eating fiber-rich foods like fruits, vegetables, and whole grains. You can start doing gentle exercises to promote bowel movements. And lastly, in some cases, stool softeners or fiber supplements can help. But in this case, you need to check with your doctor first. When we were talking about the issue of constipation, we mentioned having hemorrhoids. What are hemorrhoids, you may ask? Hemorrhoids are swollen veins in the lower rectum that can be caused by the pressure of the uterus on the pelvic veins, constipation, and an increased blood flow. They can be itchy, painful, or even bleed. So what can help you? You can start taking warm seat bath. You can start using witch hazel pads or cream for relief. You can avoid prolonged sitting or standing, and you can start eating high fiber foods to avoid constipation. Has anybody ever told you about an increased vaginal discharge during pregnancy? Well, during pregnancy you might notice an increase in vaginal discharge. It can be watery or milky, and that is due to a higher estrogen level and an increased blood flow in the pelvic area. This is typically normal, but if there's a change in color or odor, it could indicate an infection. So what could you do? You could start wearing breathable cotton underwears, keeping the area clean and dry, and avoid touching or using scented product in the vaginal area. We also need to speak about urinary incontinence, commonly known as accidental peeing. Now, in the later stages of pregnancy, your growing baby may put pressure on your bladder, leading to leaks, especially when you laugh, when you cough, or when you sneeze. This can be frustrating and embarrassing. Now, what can you do? You can wear absorbent pads to prevent the leaks. You can do pelvic floor exercises to strengthen the muscles around your bladder. The next part of pregnancy that will literally blow your mind as an emotional roller coaster. You know, hormonal changes cause a lot of emotional ups and downs during pregnancy. You might cry over a commercial one moment and feel extremely irritable the next. You know, these mood swings are often exacerbated by the physical discomfort and the emotional weight of preparing for a baby. Don't be scared when you experience this. Make sure that you get plenty of rest and ask for help when you need help. Make sure that you have someone to talk to, and that someone should be someone whom you trust with your feelings. Lastly, you should practice stress relieving activities like yoga, meditation, or breathing exercises. Has anybody ever told you about nasal congestion or nosebleeds during pregnancy? Because there is an increased blood flow and hormonal changes, it can lead to a more frequent nosebleeds and a stuffy nose during pregnancy. The extra blood in the body can make the nasal membranes more sensitive and prone to bleeding or swelling. So what can help you during pregnancy? If you stay hydrated, if you use saline nasal sprays or rinses to soothe congestion, and if you use humidifier at night to keep the air moist, you can minimize having nosebleeds or even experiencing nasal congestion. Let us talk about having acne and an oily skin. While some women experience glowing skin, others struggle with oil production due to the surge in hormones. This can lead to more breakouts, especially on the face, chest, and back. So what can you do? You can speak to a dermatologist about safe acne treatment during pregnancy. You can keep your skin clean without overwashing, and you can use gentle skincare products to avoid irritating the skin. When you are pregnant, you are more likely to experience sleep disturbances. Pregnancy often brings sleep disruptions. Between physical discomfort like back pains, heartburn, or needing to pee, the emotional changes and difficulty in finding a comfortable sleeping position, many pregnant people find themselves tossing and turning all night long. So, what can help you if you are pregnant and you are experiencing sleep disturbances? You can use pillows to support your body, especially between your knees, to relieve hip pain. You can sleep on your side, especially the left side, for better blood flow to your baby. And you can practice good sleep hygienes like turning off screens, creating a calming bedtime routine, and etc. Listen, pregnancy can come with a lot of challenges that aren't always discussed openly, but it is helpful to know that you are not alone. Many of these things will resolve or improve after birth, but for some, they can be a part of the journey. So it's always a good idea to speak with your healthcare provider about any discomforts or concerns to get the support you need. If there's anything you learned from this video, kindly leave a comment in the comment section and subscribe to our channel to help us grow. And if this video can help someone whom you know or you think can help someone anywhere, kindly share it to them. It means a lot to us. We'll see you on the next video.